Hello and welcome to the Maine Immunization Program's webinar on how to submit your provider agreement using the Maine Immunization Registry ImmPact2. If you would like to enroll to become a Maine Immunization Program provider, your first steps will be to complete and submit a provider agreement. For those of you currently enrolled in the program, you will need to renew your agreement on an annual basis. To ensure that your practice continues to have the ability to order and receive vaccine, you must submit your agreement before the end of the calendar year. Once the next calendar year starts, providers without a current agreement will not be able to place vaccine orders. In addition to the annual provider agreement, ImmPact2 users are required to review the ImmPact2 security and confidentiality policy and submit an annual ImmPact2 user agreement. We're going to begin by logging on to the ImmPact2 system. You'll want to type in your organization code, your username, and your password, and click the login button. And this will bring us to the home page of ImmPact2. You'll notice on the left-hand side of the screen there is a blue menu bar. This menu bar has a variety of options based on your role in the practice. For this demonstration, we will be using the 3 links located under the Manage Operations heading. First, before we begin to update our provider agreement, which is referred to in ImmPact as a site contract, we are going to update our clinicians and our providers. Click on the Manage Clinicians link. This will bring us to our clinician search page. There is a drop-down for those of you who are associated to multiple sites. If we click Find Clinician, you'll notice that all of the clinicians located under this site will show. It'll show the name, which is highlighted in blue as a link. You can click on this, and this will bring us to the edit portion of the clinician information. So if you wish to edit your clinician, just click on the blue link, change any information that you would like. You can hit the cancel button, and this will bring us back to our clinician search page. We can add a clinician at any time. Type in the last name and the first name. Under the vaccine administrator type, this can either be a site clinician who administers vaccines at your practice, a mass immunization clinician who is only being used for your mass immunization clinics, or for both. Once you have the correct type of administrator role assigned, you will assign sites. You can click the add button to move over to the selected sites, any of the sites that you are associated to have that clinician be able to administer vaccines at. Once you have selected all of the sites, click the Save button, and you will see that your clinician has been saved. It is mostly the same information on the Manage Provider link. Same type of search. Make sure you have your site chosen. Click the Find button, and you'll see all of the providers listed under your search results associated with your practice. You can utilize the last name, first name search if you are a practice that has multiple providers. Utilize the first 3 letters of the last name, first 3 letters of the first name search. Click the Find button, and you will notice that your provider who matched your search criteria will show at the bottom. We can click Add to add a provider. Type in the first name, the last name. There are several fields for you to fill out, although only the last name, the first name, and the site associations are required. Again, click on your highlighted sites, click the Add button to move these over to the selected sites. Once you have all of your sites selected, scroll back up to the top and click the Save button, and you will see that your provider has been saved. Now we can begin to enter our information on our provider agreement. Click on the Site Contract link, and this will show you a history of previously submitted provider agreements if you are an existing Maine Immunization Program provider. You do have the ability to click on the PDF files, print and review these before you submit your current provider agreement. To begin submitting your current provider agreement, click on the Create New button. This will bring us to page 1 of the site contract. You'll want to type in your practice name, organization, your vaccine manager information, your vaccine delivery address, your vaccine mailing address. For those of you who do have a different delivery address than your mailing address, it is very important that we have the delivery address that the site will be receiving vaccines at. You need to indicate any days that your office is closed so that you are not shipped vaccines on days where your facility will not have a person to receive these. Your facility type is required. If you do not fall into any of these categories, click on the Other and type in the text box under the comments section. Your age patient cohort, whether you see people 0 to 18 years of age, 19 to 99, or 0 to 99. Once you have all the information filled on this page, click the Next button. This is the estimated vaccines by age group and insurance. We receive our funding from the federal CDC based on the Vaccines for Children program. It is very important that we know the number of children you have enrolled in your practice that fall in these categories so that we receive an adequate amount of funding for our vaccines. It is also important that we know the number of children you have in each category of age so that we know that you are ordering the appropriate amount of vaccine. So you'll want to list your patients who fall into these age categories for either enrollment in Medicaid, without health insurance, American Indian or Alaskan Native, underinsured, or who have private insurance. And there is definitions for underinsured down here at the bottom. Once you have all of your numbers filled out, you'll want to click on the Next button. And this will bring us to page 3, and this is where you can add or edit your clinicians. Since we have previously done this, you will see all of our clinicians and providers listed here. You will want to note if you're adding or editing your providers and clinicians from your site contract page, you will automatically be sent to the homepage of ImmPact2. You will have to navigate back into your site contract to finish filling out your current provider agreement. Click the Next button. This brings us to the Vaccine Storage and Handling and Accountability Plan. The top, primary physician responsible for the vaccine with a secondary, and a person with 24-hour access to your building. This is important in case of a power outage outside of normal business hours. During the power outage, we would like to know if your facility has a backup generator. If you do have a backup generator, you can skip to question number 5. If not, you'll want to list a location with a contact where you will be moving your vaccines during your power outage. We would like to know how you will be notified when a power outage occurs. We don't want you to list CMP. CMP does not normally call practices if their power has gone out. We'd like to know how you're going to be notified, either if you're hardwired your refrigerator or if you are a facility who is owned by a hospital. You might be on site and the hospital has 24-hour access and will notify you of your position. For smaller towns, you might have your physician next door to your practice. If that's the case, what happens if your physician is going to be out of town? You need to have a backup there. So each notification is going to be unique for your practice, but you need to make sure under any circumstances that you will have notification if your power does go out. Number 6 is where you can purchase dry ice. This is for varicella, when varicella is moved. Also a refrigeration company if you are a practice that has a large amount of vaccines that might need to be moved. Number 9, who is responsible for training new staff on the storage and handling procedures? And this is going to primarily be your vaccine manager. You need to describe your procedures for monitoring your refrigerator and freezer temps. And at a minimum, your procedure should include all 5 of these steps. You need to name the responsible person. You need to check temperatures twice a day. adjusting the thermostats and documenting these when these are out of range, and notifying your vaccine manufacturers for viability of vaccines. Question 11, describe your procedure to ensure vaccines are immediately unpacked. And this will help your vaccines remain viable if you include at a minimum 1 through 6. When the vaccines arrive, you should notify the appropriate staff. They should unpack your vaccines and monitor to make sure the cold chain was not activated. Your vaccine should be checked against the packing list for lot numbers. They should immediately be placed in the appropriate unit, whether it be your refrigerator or freezer. You should not pre-draw vaccines, and your temperatures should be recorded twice a day. Number 12 is do not plug on stickers. These should be placed at a minimum on your unit, on your outlet that your unit is plugged into, and on the circuit breaker. We do provide these free if your facility does not have these. Describe your plan for ordering vaccines, controlling inventory, and ensuring accountability paperwork is submitted to the program. At a minimum, you should be ordering vaccine in accordance with a 6-week supply. You should submit monthly temperature logs and monthly usage reports. Number 14, describe a plan for minimizing vaccine wastage. At a minimum, you should rotate your stock. You should not keep vaccines in the doors of your storage unit. They should be placed in the middle with airflow in between. You should transfer your short-dated vaccines to another provider, and you must not pre-draw your vaccines. Vaccine storage equipment. You need to indicate the type and the quantity of all of the units you have in your practice storing vaccines, whether they be a standalone refrigerator or freezer, or a refrigerator such as a household style refrigerator that has separate exterior doors for your freezer and your refrigerator. Check the box and type in the quantity of each unit that you have. At the bottom, the vaccine manager name and your prescribing physician who will be signing on your provider agreement. Click the next button. This is the agreement signature page. You will type in the name of the vaccine manager and the prescribing physician. Click the next button. Name of physician in charge, title of the physician. You need to read the statements listed above. Agree to the statements. Click the next button. This is attachment A, which covers all of our provider requirements for the program. You must read through all of these, agree to the statements above, and click the next button. Attachment B is the vaccine wastage worksheet. This is what you will fill out and submit to our program if you have any wastage at your practice. Agree to the statements above, click the next button. Page 9 is the notifiable conditions list. You are required as a Maine Immunization Program provider to adhere to notifying the Maine CDC of any patient who has any of the conditions listed above. Agree to the statements above. You can either save your contract and come back to it to make changes, or you can click the Save and Submit button. This will bring us back to our site contract homepage. You'll now notice there are PDFs available for your entire contract, for your signature pages, and there is a link where you can go in and make any changes to your provider agreement. Your PDF signatures must be printed and signed by your vaccine manager and your prescribing physician and faxed to our Maine Immunization Program. These should be faxed at the same time that the ImmPact2 user agreements, which have been signed and inclusive of your PIN and your facility information. All of these need to be faxed to the program when you are submitting your provider agreement. This concludes our webinar on how to submit your annual provider agreement, and I hope you found this webinar informative, and I want to thank you for listening.